Oh, I don't know why I was having those technical
I
difficulties.
don't know either. We need geniuses here. I'm glad I'm here with you, Ryan.
Happy to have you here and very excited about this conversation.
Yeah, me too. Me too. Thanks for having me.
Absolutely. So I think we should just start with some introductions. This is our first live on our Pandia Menopause page, so that's very, very exciting. So, Dr. Catherine Hansen, if you'd like to give a brief introduction.
Absolutely. And I'm seeing some people come in. Carla's come in. Literally nothing alike has come in. Catherine has come in. This is
Yeah.
awesome. Yeah, so I'm Dr. Catherine Hansen, board certified obstetrician and gynecologist, and I am super excited to be Pandia Health's head of menopause as we launch our clinical telehealth menopause services. Pandia Health's head of menopause, and my real passion is educating, equipping, and empowering women to live their very best life.
That's awesome. Yeah. And my name is Ryan for everyone out there watching us. I am Pandia Health social media manager, but I'm also currently pursuing my master's in social work. So today we're going to be talking about mindfulness and menopause, but a little quick thing about Pandia Health and what we do. We are a woman-founded, woman-led, doctor-led hormonal healthcare delivery service, and we're rooted in the belief that women should never have to struggle to get care and medication that they need. We want to provide accessible, affordable, and personalized care. We're really big on making sure our patients know that we are there for them. And we're really excited that we just launched Pandia Menopause.
Yeah, great time for women, for midlife women, and for all of the available options that are coming to the forefront for midlife women. And today we're going to talk about one of those options that most people don't talk about very often.
Yeah, absolutely. Let's dive right in. If you want to kind of give us a little bit about menopause, perimenopause, some of those symptoms, and the challenges that women face, but how we can overcome those challenges.
Yeah, absolutely. Absolutely. So I think it's important to understand the definition of menopause, and I think women are hearing this over and over as we get to understand our bodies better. So perimenopause is that time frame when symptoms just kind of start, and people don't always recognize that, oh, this could be related to perimenopause when things get started in sort of early 40s, mid 40s, even sometimes late 30s. I've had patients in the office with some of those symptoms. And so as hormones start to decline, this is the perimenopause. And when there's been one full year with no menstrual cycle, so one full year of what we call amenorrhea, that is menopause. So it's kind of like the anniversary of your last period. And then there's postmenopause, which is everything thereafter. We now know that women spend sometimes up to 50% of their lives postmenopause. So it's not just a stage or a phase to brush over. It's a really important time for women to be productive and healthy and happy and vital and alive.
Yeah. And so, what are some of those symptoms that women are experiencing during that time?
Yeah. So, main symptoms, as we hear about, and probably a lot of women experience hot flashes, night sweats, insomnia, vaginal changes, bladder changes, some of those sort of physical changes that we can get sort of aches and pains, muscle aches, joint aches, those sort of vague symptoms. Brain fog is another one we hear about a lot. And as we're talking about this, I just want to encourage people to be putting questions into the comments and putting comments in as well. What is the symptom that has been the most bothersome for you? And that's going to be sort of helpful for us to guide our conversation today.
Yeah. And we really want to have this conversation today about mindfulness in menopause because at Pandia Health, I think we really recognize that the menopausal journey is not just a physical transition, but it's a holistic experience that really impacts both your body and your mind. So by exploring mindfulness in the context of menopause, we really want to empower women with those practical tools and insights to navigate this phase with resilience and self-awareness and non-judgment and just a sense of well-being.
Yeah. Absolutely. And I know we've had lots of conversations about menopausal hormone therapy. And today, like I said, we're going to talk about something that women don't hear about a whole lot, and that is that integration of body, mind, and soul, and some of the ways that those practices can actually scientifically proven to alleviate some of those symptoms.
Yeah. So I think it would be good to kind of talk a little bit about what is mindfulness. And I always like to say it's the art of unpacking our thoughts and our emotions and our sensations free from scrutiny. It really invites us to sit with discomfort that we have and acknowledge it and learn how to embrace it and ultimately let it go and continue to thrive in our lives. It's about being present, and even when that presence means confronting the unease that sits within us, you know, allowing ourselves to really feel that discomfort head on and acknowledge the things that are happening, again, without judgment, I think is a really, really big one, because we want people to embrace this stage, right? We want them to thrive in it.
Yeah, absolutely. And I don't think you're expecting this question, Ryan, but feel free to throw it back at me. But I'm curious, what mindfulness practices do you use? And I'm quite sure you're not experiencing menopausal symptoms, but it's good for everybody at every stage of life. What practices do you use?
Yeah, absolutely. So, one thing I find really interesting about mindfulness is I think a lot of people, the first thing that comes to mind is like meditation. And I always tell people that I personally have tried meditation and that just wasn't something that worked for me. And there's so many different techniques we can use for mindfulness. So, you know, deep breathing exercises, body movement exercises. I really like the idea of mindful walking or mindful eating. It's, you know, you're putting focus on the actions that you're doing. There's journaling. So it's not a one size fits all type of technique. Everyone has their own personal journey with mindfulness and kind of figuring out what works for them. Uh, Personally, I think I'm really big on journaling. I love to journal. I think it's a great way to understand our thoughts. But then whenever I'm having any form of, you know, body sensations where I'm feeling overwhelmed, deep breathing is a big one for me. Really learning how to focus in on my breath. I really like the one where you kind of let it all out, bring it all in, hold it there and let it all out, and you count through those steps and allow yourself to kind of refocus.
Wow. And just adding a little bit of the physiology to what you just described with that big breath is that when you expand your belly with a big breath like that, you actually engage your vagus nerve or your parasympathetic system and bathe your body in those beautiful calming and healing hormones and neurotransmitters. So there's a real physiological explanation for what's happening. Thanks for sharing that practice with us.
Yeah, absolutely. Are there any techniques that you use personally with mindfulness?
Yeah, there's lots, and I like to talk with women about this as kind of being the way that we don't let our life go by. So I love thinking sometimes about my grandmother who used to really spend every minute in the moments. You know, whether she
Mm.
was making bed, whether she was cooking dinner for us, whether she was, you know, combing our hair, whatever she was doing, she just felt so present. So she lived in a simpler time without all the distractions, and I kind of equate the day-to-day mindfulness as how my grandmother used to live her life. I would say the one big practice for me is yoga. When I unroll my yoga mat and I put my toes at the front of my mat, there is nowhere that my mind is except in that moment and where my toes are standing, and that brings me back into my body in really profound ways.
And I think that's a really great point that you make about being able to practice mindfulness just throughout daily life. I mean, that's the other beauty of it, is it can be done anywhere at any time. If you're sitting in traffic or at the grocery store, you can practice those techniques.
Absolutely, absolutely. And then swinging it back to menopause. So I think that it's really important for women to realize that 50 to 80% of women are actually looking for non-hormonal therapies for their menopausal symptoms. So a huge number. And mindfulness techniques, as we'll talk about, are some of those therapies that are helpful for women who are looking for alternative, integrative, or more holistic ways to manage menopausal symptoms.
Yeah, I mean, menopause can be accompanied by that increased stress. And when we have these mindfulness practices like the deep breathing or the yoga, it reduces those stress levels because it brings us into the present moment, and women can find that sense of calmness kind of amidst all those changes. Or even applied to specific symptoms like hot flashes. If you're having a hot flash, by mindfully acknowledging the sensations that are arising in your body, by being able to understand what is happening, we can then respond by being gentle with ourselves and reducing the intensity and the duration of those hot flashes.
Yeah, absolutely. And so the Menopause Society, just to kind of throw down the evidence on this, the Menopause Society has a good white paper on non-hormonal management of vasomotor symptoms. And just as you describe, they've done studies on mindfulness techniques and mind-body techniques. So they did psychoeducation, really talking to women about what is happening in their physiology, just so that women can understand and have some semblance of control over really the sometimes the body that feels out of control when we're having a really incapacitating hot flash. They also did paced breathing, which is similar to what you just walked us through, and they did other cognitive behavioral therapies such as like you said, they talked about mindfulness meditation, they talked about acceptance, and they even talked about yoga. And they found that there was a reduction in the severity of vasomotor symptoms, although they weren't necessarily able to reduce frequency with what they did. But I want to caveat that in a lot of these studies with mind body techniques on the fact that we don't necessarily study them the
Yeah.
way we need to. And in medicine, we're busy studying a lot of medications and we're studying a lot of medical techniques and procedures. And these mind body techniques that we're talking about with mindfulness are not necessarily studied with the same scientific rigor. And it's really hard to eliminate confounders, as you can imagine. So we know actually scientifically that women who feel good about menopause coming and they feel positive about it, they have less symptoms.
Wow.
So, there's a lot of this mind-body connection that we don't necessarily understand in a very specific, granular way, but we know that it overlays everything we do and all the ways we live.
Yeah, it goes back to that holistic experience that women are having. I mean, like you said, a lot of women are spending 50 or more years postmenopausal. And so you want to, and I know you say this a lot, menopause is a time to thrive. It's a time to embrace and thrive in your life. And so, how do we get women to that point of that acceptance and, seeing how there is this beauty in the way our bodies are changing?
Yeah. Absolutely. And again, while we're talking, because we're going to come to a close and we're going to want to know what people are thinking and asking, what questions do people have about non-hormonal therapies? What questions do people have about mindfulness techniques? Is it something that you as a patient have noticed has helped for you, and which techniques have helped? So we would love some of those comments. But I will say, I personally, and in my clinical practice, think it comes back to a semblance of having control and an ability to cope, and an action that people can take to help them cope and help them feel more in control of physiology. So I'm imagining women, giving a big board presentation, having an incredible hot flash, getting flushed and sweaty and kind of armpit stains and feeling embarrassed about that. And it feels out of control. But being able to kind of bring ourselves back to, this isn't something that's happening to me that's crazy and going to throw me off. This is life. This happens to every single woman who's lucky enough to live long enough. She will have probably some form of menopausal symptoms, whether there's vasomotor symptoms or not. So I really believe that empowering women with agency and with just a deep understanding that they have control, that things are not out of control, and that they have the ability to manage and cope, and just to take some reassurance from that.
Yeah, absolutely. I mean, mindfulness encourages that body awareness and that self-compassion. And by staying attuned with the body's signals without that judgment, you can develop a more positive relationship with your changing body during menopause. And I think that's really important to, recognize that.
Yeah. And one of the biggest things that that I say in my practice and that we reiterate at Pandia Health is that being an advocate for yourself, being informed. We know that at least 3/4 of women don't feel well informed about hormonal, non-hormonal, prescription, non-prescription options, and a true 50% will state that they're confused. So
Mm.
50% of women walking around confused, 3/4 of women walking around feeling not well informed. And how are women, really strong, professional, powerful women going to make decisions for themselves if they're confused or not informed? And so that's what we're doing here today. That's what I do in my practice. That's what we're constantly trying to do with what we're putting out from Pandia Health in terms of written and video, and just helping women know how to get the answers, where to get the answers, so that they have that sense of agency in their lives.
I mean, Pandia is all about education, but then also empowerment.
Right.
Empowerment and taking that control back.
Yeah. And that's what it's all about, this stage of our life, to reawaken and reemerge and to live alive and thriving and vital.
That's great. That's amazing. So, are there any other kind of non-hormonal therapies that you suggest to women that are also, because I know you said there's a lot of women out there that are looking for non-hormonal therapies.
Yeah. So we've had this conversation in terms of non-hormonal
Mm.
prescription therapy. We did that in an entirely different live, and I think that involves an entirely, a very long, comprehensive conversation, because there are non-hormone management options available in prescription, and there are hormonal non-prescription options. And we've really dug into all of those areas at Pandia. But I will just say, in answer to your question, I always build the foundation for women on a really holistic lifestyle. And so that involves diet and nutrition, some supplements that are aligned with what's needed at midlife for really preventative health. Exercise, super important. And there's various types of exercise that are more important for midlife women that maybe weren't important at earlier stages of life. Sleep hygiene. If a woman's not sleeping, she knows what I mean. It gets a bit crazy making. And there are ways to improve restorative sleep. And stress management. And that's what we're talking about today, with mindfulness being one of those stress management techniques. So I really build everything we do with menopausal women on that foundation of lifestyle, with diet, nutrition, exercise, sleep, and stress management. And then on top of that, hormone prescriptions, non-hormone prescriptions, and/or non-prescription measures. So there really is a long conversation to have with women, and lots to learn in order to be able to advocate. It can be a confusing space, but we really want to make it clear and help women understand that these are the best years of your life.
Yeah, and I know Pandia Health feels so lucky to have you, because we really do stand on, we have so much pride in our personalized and treatment for our patients and the care that we provide our patients. It goes beyond the medicine, right? It is a holistic approach. We want to help you feel well-rounded in your treatments. And so I am very happy that we have you at Pandia Menopause to provide this care for our patients and to continue to educate. And for anyone that's watching right now, please know that we intend to do these lives around twice a month so that we can continue to educate people about all the ins and outs of perimenopause and menopause and how we navigate these symptoms and how we navigate this transition.
Absolutely. And I know coming up, Dr. Stephanie Culver, who's also a Menopause Certified Practitioner, will be doing a live on a specific estrogen-related pharmaceutical prescription. And as a way of educating around estrogen patches, I know they're going to have that conversation coming up. So definitely watch for it. And Ryan, it is an absolute honor and a privilege to be able to serve women in this way alongside locking arms with Pandia Health. It's truly, truly an honor and a privilege for me. So I appreciate everything we're doing to help women feel great.
Yes, yay. And so many exciting things to come. Definitely everyone should check out Dr. Stephanie Culver's live. I believe it will be February 9th. So
Yes.
that's very exciting. But just to kind of recap what we've talked about today, we really focused on mindfulness and menopause, the importance of embracing this change, focusing on stress relief, that deep breathing, those techniques. Do you have any kind of final words of advice that you'd like to share with the audience?
Well, thank you for that. I just want to really emphasize and drive home this fact that women have agency, that they have some control over what's happening to their body, that mind body techniques are not to be underestimated, and that this isn't just sprinkling on top positive affirmations and expecting everything to be better. This is really setting up and establishing daily practices, rituals, moment to moment techniques that allow us to come back into our body, to be in our lives, to be really tapping into the joy and the fulfillment and the meaning that comes from living this one precious life. So thank you so much for having me here today.
Thank you so much, Dr. Catherine Hansen. And if anybody has any more questions, you can always visit our website at Pandia Health and check out some of our great blog posts and all of our social media. And Dr. Catherine Hansen, you have a website as well. And you have a very exciting event coming up if you want to talk about that real quick.
Yeah, thank you for letting me share.
Yeah.
So I have a webpage, drcatherinehansen.com, and I serve midlife women, and we are doing a 2024 visioning event on January 18th. It's going to be in the evening, depending on what time zone you're in. So go on over to drcatherinehansen.com and click on events, and you'll see all about that visioning event. We're going to be setting up to curate our year with renewed purpose and inspired action. Myself and Pandia Health, we're all about action, taking action to be healthy, to feel healthy. And we really want to set out on the year to ensure that we're aligning with those intentions of our life, of our year, so that together, collectively as women, we can rise.
So many great things are coming. I'm very, very excited. And thank you guys for joining our talk. We're really happy that we were able to share this information with you today.
So thank you everyone for coming.
Yes.
Listening real time or later. We really appreciate you, and we look forward to serving you in whatever ways that you would like us to.
Bye.
Bye everyone.